Good afternoon. My name is Renee. So the scenario. This 54-year-old that has been brought to me from EMS needs to be evaluated and treated right away. The first thing I would test is for any kind of drugs. Someone can have substance-induced psychosis. This is treated extremely different than if it was not drug-induced. If she is tested positive for drugs, then she would be sent to an inpatient facility that a detox center. There will be this is where they'll get her clean and test her more in depth for anything else, like mental illness or medical. However, if she is tested negative for drugs, then she needs to be evaluated by a psych provider. Once she is evaluated, she'll be started on either medication or her monthly injection. However, before any of this even happens, we need to find out if she is already been screened for SMI. So once she has a SMI determination, then we will find her clinic and her case manager and staff with them on what to do next. Sometimes they have an outreach program that will allow you to figure out how long her last injection was and so forth. It is very rare that a 54-year-old with mental illness has not been SMI evaluated for treatment. So based on my first impression of the patient's actions and appearance, I suspect this person is experiencing symptoms of paranoia, delusions, decompensation due to being off her medications for too long, and she's probably scared. This person might be having an episode of psychosis. Some short-term health risks I would suspect from this patient would be a skin infection from the open wounds from her face and her arm from when she fell, and with it, her being dirty and either debris or whatever gets inside of it. She might have a UTI or bladder infection due to the smell of urine, so she probably either having some kind of bladder problems. Some long-term health risks I expect the patient to endure would be her mental state. Every time someone goes through a psychotic break, their mental function lowers and becomes slow. This person might not recover completely and remain impatient. Involuntary hand tremors or shaking hands can result from either substance use such as meth, ecstasy, cocaine. Hand tremors can also be a side effect from medications such as albuterol or antidepressants. Some tremors can be a sign of Parkinson's disease, low blood sugar, and thyroid conditions. Confusion can result from a psychosis state and no longer remembering anything and not being alert. Time 6. So the time 6 is know who they are, know where they are, know what's going on. I forgot the other two. Combativeness is normal, and patients experience confusion due to not knowing who or what is going on. And so some assessments I believe this patient needs is for drugs, maybe poisons, mental exam, a full blood panel for diabetes, blood levels, especially the white blood count. And if we can figure out who this is, if is she considered Jane Doe or if they know. That way we can find some family members and medical history that can help us. Alright, so that's it for that. So the recess question. Mental illness management includes both pharmacological and other therapeutic methods for treatment. Therapeutic methods include, but not limited to, cognitive behavioral therapy, motivational interviewing, and DBT. Those DBT I know and CBT are mostly how to change. So if they're not ready to change, then other things need to be done before they can get those treatments. So SMI patients are at a higher risk to use substances to relieve symptoms of depression, anxiety, schizophrenia, and paranoia. However, trying to manage a patient for mental disorders and substance abuse can be conflicting as they react to one another and block some receptors. The silver lining of a patient with dual diagnosis of mental illness and substance abuse is that insurance covers a lot of substance abuse treatment. It is very easy for a patient to be prescribed methadone at a methadone clinic for treatment of opioid abuse. However, unless you qualify for state insurance, mental disorder treatments can be very expensive. So we have two categories. One is called non-titled, which means that they are overqualified for the state insurance, and we have titled, which are under the amount, so they qualify for access or state insurance. So with the people that are considered titled, they qualify for counseling, transportation, bus passes, case management services, medication management, medication that's some psych providers, PCP, nurses, all that, and including housing services such as temporary living places, group homes, and a housing vouchers that it only pays 30% of your income. Depending on how much level of care you need, whether you need a 24-hour staff present, 16-hour, 8 hours, and then completed by yourself. So, non-titled SMI patients are eligible for limited transportation, so it's only medical transportation, case management service, medication management, and medication, but with copays. So they're not eligible for like housing, any kind of counseling, unless they pay out of pocket and they will get referred out of the clinic. For an SMI patient that is titled, patient get significant assistance with treatment. So I think I would add more housing for those individuals due to. Okay, so let me tell you a story. I asked a patient why he uses, and his answer was because he was homeless. I asked him, the only reason why you do drugs is because you're homeless? He goes, yeah, because when I'm doing drugs, I don't worry about food, shelter, safety, just his next fix. So I asked him, if you got your house, you had help with getting your house, what would change? He said everything. I would have to worry about food, so I would have to get a job, and then I had to get insurance, and he said his life would be 100 times better just if he got assistance with his house. So